When you play sports, proper equipment can help your game, but knowing how to use your equipment is critical to being a good player. It's the same in aseptic compounding. Having the proper equipment and knowing how to properly use it makes all the difference.
Syringes are one of the key pieces of aseptic compounding equipment. Syringes are hollow tubes used for injecting or withdrawing liquids. They come in a variety of sizes and are made from either plastic or glass. Plastic syringes are disposable and come inside sterile packaging. Plastic is both the most common and the least expensive type of syringe. Glass syringes, on the other hand, are very expensive, but are necessary for medications that react to or are absorbed by plastic.
Syringes consist of three parts: the tip, barrel, and the plunger. The tip of the syringe provides a spot for attaching a needle or other devices. The tip may connect with ports via luer lock, threaded channel, by forced friction, or slip channel. The barrel holds the liquid within the syringe. The plunger is a rubber-tipped rod that fits inside the syringe. It's used to press the medication through the syringe without leakage. The open end of the syringe terminates in a flange, often used as a finger rest during syringe manipulation.
There are some basic rules to follow when using syringes and maintaining their sterility. Never touch the tip of the syringe, the interior barrel, or the rubber plunger tip. If these parts come in contact with you or a non-sterile environment, then the sterility of the syringe has been compromised and it must be properly disposed of. Like syringes, needles come in a variety of sizes, also known as gauges and lengths. Needles are sharp, hollow tubes. One end attaches to the end of the syringe barrel, and the other end is pointed and used to inject or withdraw solutions. The larger the gauge number, the smaller the diameter of the needle. The smaller the gauge number, the larger the diameter of the needle. The most common needle sizes used in sterile compounding are between 16 and 26 gauge. Needle hubs are color-coded to meet ISO standards of easy identification. Typical gauges used in injections include, for sterile compounding, 16 to 20 gauge, for intradermal injections, 26 to 28 gauge, for subcutaneous injections, 26 to 30 gauge. Needle lengths normally range from 3/8 inch to 3 inches. The type of injection determines how long of a needle you need. The deeper the injection, the longer the needle. For example, a subcutaneous injection may only need a 1/2 inch needle, where an injection into the muscle may need a 1.5 inch needle. Needles consist of three parts: the hub, the shaft, and the bevel. The hub, or colored part, is used to attach to the tip of the syringe via luer lock or friction. The shaft is the length of the needle. The bevel of the needle, even though it is small, has two parts, the heel and lumen. The heel is the flat, rounded end at the top of the bevel and base of the length. The lumen is the interior dimension of the needle.
Needles come in three configurations: standard long, standard short, and blunt fill. The standard long and short bevels have a short tip to allow for easier site puncture, and the blunt fill have rounded tips that are not as sharp. Blunt fill beveled needles are designed with safety in mind and are only used when compounding, as they would be very painful if used in patients. Now, these needles do increase the instances of vial coring. Two other types of needles that are used in compounding are filtered and vented. Filtered needles are used to draw or expel fluid from a syringe that may also contain small particles, such as undissolved drug particles, glass shards from an ampule, or rubber particles from a vial coring. The filter makes sure that the unwanted particles don't enter the solution. Vented needles are used to prevent medication or solution from becoming pressurized when transferred into a vial. A pressurized vial may aspirate or spray its contents if not properly vented.
We shouldn't conclude our discussion about syringes and needles without mentioning filters. Filters are used to remove unwanted particles, such as glass, rubber, and fibers from solutions. They come in a variety of sizes. Here is how they work. Filters are loosely classified by the size or nature of the particles they remove from the solution being purified. Filters are non-fibrous membranes containing millions of capillary pores of specific size with a plastic housing. For instance, A 5-micron filter removes large particles, but does not remove bacteria or fungi. A .22 sterilizing grade filter is typically used when compounding a sterile preparation. It will remove all fungi and bacteria, producing a sterile solution.
Now, let's talk about the containers used to store aseptic compounds we've prepared. Intravenous or IV bags are latex-free, plastic bags designed to maximize the delivery of fluid inside by collapsing as the fluid exits. These bags come in a variety of sizes, yet are classified as either large volume parenterals, or LVPs, or small volume parenterals, or SVPs. LVPs contain volumes 500 milliliters or greater, while SVPs, also called piggybacks, hold anywhere from 25 to 250 milliliters. Empty and sterile IV bags, which come in the same large and small volume sizes, are used when compounding special fluids from scratch. The standard IV bag has 3 parts: the bag, the tube set port, and the injection port.
There are a few commercially available proprietary bag and vial systems that have features unlike the others we have already talked about. The Mini Bag Plus is a piggyback-sized bag that allows transfer of medications without needles. How is that possible? This IV bag has a port at the base of the bag for attaching standard vials.
Advantage bags are small volume with a special port at the base of the bag. The vial is attached to the port by snapping the bottle cap into a locked position with an internal seal in the bag.
Some other containers used to store aseptic compounds include glass bottles, which are not commonly used, but necessary when medications are incompatible with plastic. Vials are used for storing medications used in IV preparation and are made of glass or plastic. Vials have a rubber stopper on top for needle insertion and fluid withdrawal. Ampules are glass containers that are broken at the neck to access the medication with a filter needle. Ampules are used when the stored fluids may react to the rubber or plastic in vials. An empty evacuated container, or EEC, is a sterile glass bottle used as a container for sterile solutions. EECs contain a vacuum to allow for easier withdrawal and transfer of fluids during compounding.
In addition to a variety of containers, there are a few other special pieces of necessary equipment used for aseptic compounding. Sterile alcohol swabs are small, individually packaged gauze pads soaked with 70% isopropyl alcohol. Now, these swabs are used to disinfect bottle and vial tops, ampules, and IV ports, just to name a few common uses. Disinfecting these container ports prior to needle insertion and fluid transfer is vital to preventing contamination and maintaining sterility of the compounded preparation.
A transfer set is a tube set with a spike at each end. Transfer sets may be used to connect an IV bag or bottle to an empty IV bag or an EEC for fluid transfers. Transferring the fluid with this method allows a sterile transfer. An intravenous tubing set is another way to transfer fluids from one vessel to another. Tubing sets are made of plastic and have 5 components. The first component is the spike. The spike is a plastic pointed device used to connect the tube to the IV bag, vial, or other container. In order to keep the contents sterile, the spike should never be touched. Once the spike's cover is removed, it should quickly be inserted into the appropriate port to prevent any contamination of the medication. The second component is the drip chamber. This chamber is just below the spike and may have graduated marks on the side to help calculate and measure drip rates. These sets with a graduated chamber are called Buretalls. The drip chamber regulates the flow of fluid in the IV tube.
The third component is the roller clamp. This clamp starts and stops the flow of fluid into the IV tube set. The roller clamp works with the drip chamber to regulate how much medication gets to the patient. The fourth component is an additive port. This port allows for the addition of medication to the IV line without having to restick the patient. The fifth and final component of the IV tubing set is the needle adapter. This will have a Luer lock adapter that allows the tubing set to be connected to the needle that is inserted into the patient's vein. Like needles, the needle adapter must remain sterile to prevent contamination of the medication.
Another handy device for working with fluids is a dispensing pin. The dispensing pin has a large plastic needle port on one end and a tube set port extending from the other. A dispensing pin is used to connect multi-dose vials to syringes for needleless withdrawals, or to connect bottles to tubing sets when withdrawing fluids. A stopcock is a small device that consists of 3 ports and a valve, used to direct flows of fluids. A stopcock is used when transferring large volumes of fluid from one container to another, or for syringe-to-syringe transfers.
Up to now, we've been talking about various tools used in aseptic compounding. Now we're going to discuss 2 types of special intravenous aseptic compounded preparations.
The first special intravenous preparation is total parenteral nutrition, also known as TPN. TPNs provide nutrition via the bloodstream and bypass the gastrointestinal tract. TPNs are used for patients who cannot eat due to bowel surgery, malnutrition, or who have experienced a trauma or critical illness. The base of a TPN consists of protein, carbohydrates, and fats in the necessary amounts to meet the patient's specific nutritional needs.
The second special intravenous preparation is chemotherapy. Now, you may know that chemotherapy is used to treat various types of cancer. But did you know that the drugs used to treat cancer must be prepared in special hoods while wearing personal protective equipment? Because these drugs are designed to kill fast-growing cancer cells. Proper handling, preparation, storage, and transportation of these drugs is essential to prevent unnecessary exposure. Unintended exposure to these hazardous drugs can cause skin or tissue damage from direct or airborne contact, or can result in other long-term effects like cancer.
A specially designed hood, such as a biological safety cabinet, or BSC, must be used while preparing and handling hazardous drugs. The hood is designed to protect the user from exposure to drugs during compounding. In addition, a disposable absorbent mat is used to catch any spilled medication. The preparation of hazardous drugs also requires additional equipment such as special filters, inline tubing, and dispensing pins made specifically for hazardous drug preparation.
The Occupational Safety and Health Administration, also known as OSHA, recommends that a chemotherapy spill kit be kept near the compounding area at all times due to chemotherapy's extremely hazardous nature. The spill kit includes splash goggles, a disposable gown, 2 pairs of gloves, absorbent material for spills, a sharps container, a dustpan or scoop, respirator or mask, and sealable bags for spill contents.